Help is available.
Treatment works. Recovery is possible.
The roots of addiction counseling actually go very deep into American history. We've traced the beginnings of this sort of wounded healer role to Native American tribes in the 1730s. That also then continues in the early 1800s. We began to see the rise of recovery mutual aid groups, and those really became the impetus for the rise of inebriate homes and inebriate asylums and the beginning of addiction treatment in the United States. As we move from the 19th century into the 20th century, we get a lay therapy movement emerging out of Boston, and that lay therapy model continued through the 20s and 30s. We then moved to the birth of Alcoholics Anonymous in 1935 and the rise of individuals within the fellowship of AA, and we saw that both in the outpatient alcoholism clinics that were birthed in the 40s, and we also saw the rise of residential programs such as the Minnesota Model Program. And then as we move through the 50s into the 60s, we get the birth of ex-addict directed therapeutic communities. And we had this role of what was then called the ex-addict counselor working within those therapeutic communities. And as we approached 1970, we began to get a birth of federal involvement in a very significant way.
In response to the outbreak of substance abuse overdoses in the Asian community in Los Angeles in the early 1970s, a number of community groups, community leaders and parents came together and started substance abuse prevention and treatment agencies on the West Coast.
And 10 years later, in 1982, following a turbulent battle over the integration of alcohol and drug treatment counselors, we began to get NAADAC officially organized as we know it today. And since that time, NAADAC has been the leading professional association of addiction professionals, in particular addiction counselors, through that time period.
You know, Recovery Month was started back in 1989, was the first national observance of Recovery Month. And prior to that, there had been some iterations of Treatment Week, celebrating those that were providing the services, but it really came into its full force as we know it today, back in 1989 when the White House issued a proclamation naming September as Treatment Month, Treatment Works Month. So I think we take it from there, and we see that NAADAC was very much involved and engaged in the development of National Treatment Month.
NAADAC first came into my world, if you will, in the late 80s. Back in New Mexico, we did not have licensure till the middle 90s. Actually, the mental health license came in 94, and then the substance abuse license came in 97. And so in the late, and I was certified, what we called certified alcohol and drug abuse counselors back in the middle to late 80s. And so NAADAC at that point was the organization that would help counselors get certified and help us in terms of preparing for the test, getting the counseling, educational hours and such. And that's how I first got involved. And very shortly, I think I was only a member for like a year before I actually became president for the New Mexico affiliate of NAADAC.
Currently, the addiction treatment profession constitutes a workforce of about 85,000 full and part-time individuals working in specialized addiction treatment settings. They're also increasingly working in other settings, working in the criminal justice system, working in the child welfare system, working in mental health and psychiatric service settings, particularly with individuals with co-occurring disorders, And we're now beginning to see the movement of those professionals also into delivering services through the primary healthcare system. We're also seeing an increasingly diverse workforce. For the first time, we now have more women than men working in the field. We have a very large number of people from diverse cultural backgrounds who are now working within the field. They're working in extremely diverse organizational settings and now constitute the primary workforce that treats more than 1.5 million individuals and their families entering addiction treatment every year in the United States.
Throughout my career, I have received telephone calls from former clients. Some I still get today, some with as many as 20 years of recovery. And the most wonderful thing for me is to see, especially a young couple that I may have treated the man 5 or 6 years ago. And you see this beautiful young couple, possibly with a new baby in their arms, but most importantly with the light in both their eyes, not only the client that I helped work with, but the family. I can't think of another profession where you can see the results of your work so clearly.
NAADAC brought together all these folks, so you could start to talk to people who are doing different things and understand what was working and what wasn't working.
Community-based organizations will be able to offer a full array of services to individuals who meet criteria for substance use disorders.
I think the symptoms that a recovering or a person that needs to recover brings to the table are somewhat intimidating. A lot of times they're in a really acute state of distress, and a physician just says, well, here, take this, or a nurse will say, what is wrong with that person? And it's just a process, again, for me, the collaboration with the other professions to try and say, hey, this is a fixable problem, and we have the tools and we have the science to back us up now.
Because there was so much negative stigma and discrimination about persons in recovery, particularly alcohol and drug recovery, that we needed to communicate to others that treatment does work. And so this started out with that message, treatment works. Many people go to treatment, are successful in treatment, and then live in their communities, get jobs, raise their families, vote, spend money, pay their taxes, and become viable citizens of their communities.
If we don't promote it as a profession and we don't promote it as a treatable disease, then there's nobody out there doing it. I mean, and I think that's why you see Recovery Month, you see recovery walks, you see recovery videos, talking about how treatment works, and you have folks coming out of their own recovery talking about it, and and sharing it, not just talking about it, sharing their recovery.
Cardiology, oncology, pulmonary, those are all medical models that grew up from basic science to clinical science. But addiction, not as much, because again, people had this misconception that it was a moral failing, just a social problem. But we know now, after lots of years of research, that there's a huge, enormous biological component. In fact, that is probably one of the major reasons people become addicted, stay addicted, and altering that neurochemistry, those neural pathways, is one of the ways people achieve recovery.
Well, I think treatment's become more individualized. I think we have more tools in our toolbox to use with motivational interviewing and cognitive behavioral therapy that are great partners with 12-step facilitated treatment. So I think that there are a lot more treatment opportunities.
And I think, too, the accountability that the organization NAADAC established within our profession in terms of the code of ethics, the standard of ethics. For the addictions profession, NAADAC wrote the first code of ethics, or the standards, that are followed by every state in the United States and many countries.
NAADAC has been a leader and instrumental for the addictions profession in establishing standards. Such examples would be a nationally standardized curriculum and degree programs for both undergraduate and graduate professions, to where individuals now can get degrees in addictions counseling or clinical addictions counseling.
But it really has been over these last number of decades that the science has really helped influence our understanding as addiction as a health disorder, as a public health problem, and recognize that treatment is a part of the whole continuum of recovery.
You can't help the person in recovery if you're only focusing on one aspect of that person's life and not necessarily the contributing aspects of that person's life. So sometimes the alcohol or drug use is intimately tied to histories of trauma, and if you don't acknowledge the existence of trauma, then basically you're setting up your client to relapse and you're blaming the substance when in fact it's the combination of the substance and the history of trauma.
Without hope, there's no recovery.